Hello everyone, this is Kenny Clinical here with another video, and today we're going to be talking about BRUEs, not the same BRUEs that you would hear on auscultation, but the BRUE, Brief Resolved Unexplained Events, as well as the associated ALTE, which is also standing for Apparent Life-Threatening Event. Now, this is mainly in the pediatric population, the infants. These are acute events during infancy that have apparently resolved and nothing is going on with the baby. Apparently just the mom saw the baby was unresponsive for usually less than a minute, perhaps 30 seconds, and everybody freaks out because the baby stopped breathing, maybe the baby turned blue, all sorts of colors, maybe they started having seizure-like activity that we weren't sure whether it was a seizure or not. But then the baby comes back to normal and everything is completely fine. And that is when the parents bring the patient over to the emergency room, where you then have to do an admission for BRUE. So this is mainly for patient, residents who are, pediatrics or family medicine who do pediatric admissions overnight. What you want to look out for are the most common things. Obviously, if a baby is unresponsive for a few seconds, you want to be worried about child abuse. But there's a lot of other things that it could be, such as, substance induced. Maybe they took something. You want to look at, this is where you got to get a good history, because there's all sorts of things it could be. GERD is another one. Underlying cardiac issues, infection. Now, the American Academy of Pediatrics guidelines specifically recommend against evaluating for systemic infection. They recommend against getting the white cell count, the blood cultures, the CSF analysis or culture, laboratory testing for anemia, metabolic disease, electrolytes, calcium, ammonia, respiratory disease, chest radiograph, ABG, echoes, EEGs, or studies for gastroesophageal reflux. They also do not recommend home cardiorespiratory monitoring for these infants either. And the other thing that you have to know is that for ALTEs, less than 1% of them actually result in infant death. And you might be thinking, well, what about SIDS, or sudden infant death syndrome? Well, studies have shown that there actually isn't any correlation or relation between BRUEs and sudden infant death syndrome. That what you should be doing for these family members, the parents, the scared mother, the worried father, is to educate them on what a BRUE is. Perhaps give them the proper resources to to know about life support, like get them CPR certified, maybe educate them on how they can do those things, because of course that is something that we all recommend people to know about, how to save someone's life if that situation were to happen. So we talked about all these things. Child abuse is the big one. GERD, or gastroesophageal reflux or swallowing dysfunction, is another one. Epilepsy, CNS disorders. Also, don't forget about fever, like toxins, infection. We want to look out for these things. We don't necessarily want to do a lumbar puncture on every baby who comes in with a BRUE, but you want to look out for the sleep apnea, especially in prematurity, sleep breathing disorders. These are all things that you want to be mindful of. Hypoglycemia is another one. So all these things that you want to look out for. And also, when you talk about cyanosis, make sure you ask them, what exactly was it? Was it truly a cyanotic episode? Because it could be in the parent's mind. The other thing you want to look out for, sometimes people confuse seizure-like activity for the Moro reflex. In case you don't know what the Moro reflex is, it's almost like a startle reflex in babies, and we usually test for that when we do our newborn examinations. You can definitely look it up online, or I'm sure there's other YouTube videos on how to see what a Moro reflex looks like. But sometimes the baby will just have this startling reflex that is mistaken for a seizure or some sort of BRUE for but we don't know exactly what it was because we can't, obviously what we're hearing is what the parents are reporting us. So look out for those things. It could be something as simple as a moral reflex. Now there are most commonly low risk BRUEs, things that you don't really necessarily have to worry about. Infants who have experienced BRUEs are considered low risk if they have all of the following, and I'm going to briefly run through this. Age greater than 60 days, if premature was born at gestational age greater than or equal to 32 weeks, and current post-conceptual age is greater than or equal to 45 weeks. The duration of the BRUE, obviously, we said has to be less than a minute to meet this criteria. Occurrence of only one BRUE, no prior BRUEs, and BRUE did not occur in clusters. No CPR by a trained medical provider was required. No concerning historical features. We talked about child abuse, respiratory illness, recent injury, other symptoms in the days preceding the event, such as fever, fussiness, diarrhea, and no concerning physical examination findings. So that would include anything like signs of bleeding, bruising, bulging anterior fontanelle, altered sensorium, toxic appearing respiratory distress, heart murmurs or gallops. I mean, that's a tricky one because I'm sure there's a lot of babies with physiological murmurs. Remember the criteria for what is the difference between a normal murmur and an abnormal murmur. Of course, some babies, their channels are still in the process of developing or closing, so you're still in the process of get. You might hear what we call flow murmur, which can be normal depending on the situation. So infants who meet all of these criteria for low risk BRUE after a focused history and physical exam, they don't really require much, just observation overnight. Maybe you want to observe them for 24 hours and then discharge them after the attending the next day has seen the baby and has reassured the parents. So I think we've covered pretty much everything I wanted to on BRUEs. Again, this is a very hot topic, especially in pediatrics. So if you have any questions or concerns about it, do not be afraid to raise them in the comments. Also, do not be afraid to subscribe to our channel. We do offer a lot of great content on medical school, the process of becoming a doctor, and various things like tricks of the trade for residents. So hope you enjoyed this video, everyone. I will see you in the next one. Peace.